Welcome to the 354th of the COVID calls. This is a daily discussion of the COVID-19 pandemic with a diverse collection of disaster experts. My name is Scott Gabriel Knowles. I'm a historian of disasters at the Korea Advanced Institute of Science and Technology. I'm coming to you live from Daejeon, South Korea. Today, I talk about technologies of COVID surveillance and control in South Korea and China with Youngrim Kim and Yuchin Chen. Just a reminder, you can usually catch COVID calls live on weekdays at 6 p.m. Eastern Time. Just go to the COVID calls YouTube channel to watch. You can hear COVID calls anytime recorded as podcasts on Spotify, iTunes, Podbean, or anywhere you get podcasts. You can also keep up with COVID calls via Twitter using the handle at US of Disaster or at COVID calls. Please do help spread the word and send suggestions for future guests and future topics. And please feel free to suggest yourself as a future guest. Just a brief program note here. I want to acknowledge my guest host yesterday, Esther Chernak from Drexel University, with guests Tom Hipper and Vincent Covello. It was a great discussion, episode number 353. Please go back and check that. And it was really a joy to see my colleague and friend, Esther Chernak, behind the microphone with COVID calls. She did a great job, and I hope we'll get her back for future calls. Please do check that one out. As of today, October 7th, 2021, there are 4,831,361 deaths globally from COVID 19, according to the Johns Hopkins University Coronavirus Resource Center. China reports 4,849 deaths from COVID 19. The nation of South Korea reports 2,544 total deaths from COVID 19. I've been reading an obituary or a story of advocacy for those impacted by the pandemic, and I'd like to continue that now. Headline is Richardson Berkner High School student, age 16, and a Richardson Independent School District teacher die from COVID 19 complications. This was written by Corbett Smith and Emily Donaldson and appeared October the 4th, 2021, in the Dallas Morning News. A Richardson ISD student and a staff member died from complications of COVID 19, officials announced Monday. Shania Nini McGee, a junior at Berkner High School, and Aroleta Piacek, a teacher at Krista McAuliffe Learning Center, the district's disciplinary alternative school, both died last week, said Superintendent Jeannie Stone in a message to families in the district. All of us at the Richardson Independent School District are deeply saddened by this loss and want you to know that we are here to help you in any way we can, Stone's message read. Counselors have shared this news with campus staff and students and will remain available for anyone who would like some help processing the news, she said. Neither the Texas Education Agency nor the Department of State Health Services tracks how many educators and students in Texas have died from the coronavirus. Education Week has documented through reader submissions and its own reporting at least 1,161 educator deaths nationwide, including 387 active teachers as of October 1st. More than 1/10 of that total comes from Texas. Student deaths are also not tracked directly by the TEA on the State Health Services website. As of September 26th, the state's cumulative COVID 19 case total for students in the current school year was 172,275 cases. Last summer, Jamila Diryan Imoni Barber, a senior to be at Lancaster High School, died of complications from COVID 19, making her the youngest person in Dallas County to have died from the coronavirus at that time. Barber had no known underlying health conditions, a city spokesperson said. The Stone called McGee kind, respectful, and a valued member of the Berkner High School family. Ms. McGee, 16, was a peer mediator at the campus. Prior to the current school year, she had attended Richardson Pierce as a freshman and middle school at Park Hill Junior High. Ms. Piaczek, 71, was compassionate, gracious, and a talented educator, Stone wrote. Piaczek had worked in Richardson for 20 years, 19 of them at the Krista McAuliffe Learning Center. We are in contact with both Mimi's and Ariletta's families, and we will support them in any way possible, Stone said. Richardson trustees observed a moment of silence in honor of McGee and Piaczek at a board meeting Monday evening. We were saddened with two tragic losses this past week due to COVID-19 complications, Superintendent Stone said. Stone told the crowd assembled that teachers described McGee as sweet and kind and a delight to know and have in class. Piaczek was a longtime teacher at the Krista McAuliffe Learning Center who was a dedicated and loving teacher, Stone said. Richardson reported 113 active COVID-19 cases among students and 16 among employees as of October 1st. Berkner School had 10 active cases of coronavirus and McAuliffe Learning Center had none, according to the most updated report. One of the district's secondary students is currently in an intensive care unit, said Ashley Jones, the district's director of health services, at Monday night's school board meeting. We have not seen this affect our students or staff to date like we have this week, said Jones, who later teared up during a discussion about health protocols and how kids have been impacted by COVID-19. Since August, when the school year started in Texas, the Richardson Independent School District has reported more than 1,100 COVID cases among students and more than 200 among employees, representing roughly 3% of the district's total enrollment and staff. Over that time, the district has mandated mask usage on campuses from students, staff, and visitors, despite an executive order by Texas Governor Greg Abbott prohibiting such policies. In late August of this year, the district's Board of Trustees voted 5-2 to join an existing lawsuit against the governor, arguing that he had exceeded his authority under the Disaster Act and that Executive Order GA 38 unlawfully limits the rights of the school district as an employer and educational institution to establish necessary safety measures. On September 3rd, the district's Board of Trustees reaffirmed the mask requirement not long after the district was forced to temporarily shutter Brentfield Elementary in order to stop a COVID-19 outbreak on that campus. 1 week later, Richardson and its trustees were among a handful of districts sued by Texas Attorney General Ken Paxton for violating the governor's executive order. Not only are superintendents across Texas, Paxton argued, openly violating state law, but they're using district resources that ought to be used for teacher merit raises or other educational benefits to defend their unlawful political maneuvering, Paxton said in a statement. The headline was Richardson Berkner High School student, age 16, and a Richardson Independent School District teacher die from COVID-19 complications. This appeared in the Dallas Morning News this week. Okay, I'm delighted to turn to the conversation today, and let me please introduce my guests. Youngrim Kim is a PhD candidate in the Department of Communication and Media at the University of Michigan and a Rackham predoctoral fellow. She's interested in the social, cultural, and political implications of disaster information technologies in East Asia. She's currently writing a dissertation that examines South Korea's technologically driven infectious disease governance throughout the 2015 MERS epidemic to the current COVID-19 pandemic and how it relates to the issues of national identity, marginalization, and civic participation in crisis situations. My second guest is Yuchen Chen. Yuchen is a third-year PhD student at Communication and Media at the University of Michigan. Her research looks at the transnational flow of technology, knowledge, labor, and capital, and how it relates to social experiments in China. Yuchen Chen and Youngrim Kim, thank you so much for joining me on COVID Calls today.
Thanks for having us.
Thanks for having us.
I'd like to start the way I generally do, find out where you're calling from and what the pandemic situation looks like there. Yuchen, can I start with you, please?
Sure. I'm calling from New Jersey, specifically Jersey City, and I've stopped checking the statistics since a long time ago, so I cannot really say how the pandemic situation is like here. But I'm just it's a beautiful day today, and I just always feel confused by. It's one of those days where you feel confused by this seemingly normalcy, but then I'm also participating in a conference right now, which is happening online. So through those moments, you really like those moments really remind you that you're still in a pandemic. Otherwise, sometimes there's this just seemingly normalcy out there. That's pretty
That's
much me.
what about wearing masks on the streets of Jersey City now? Are people doing that?
Yes. I think mostly people are still doing that. And usually during commuting to New York, Manhattan, people are still pretty strictly following the rules. But of course, like in the outdoor settings, it might be more loose.
It's so interesting to me. You describe, things beautiful outside seem to be getting back to normal, and yet we're conducting this via distance technology. You're engaged in one of the largest. I'm assuming it's the 4S meeting. Maybe it's a different meeting. You're engaged in one of the
Yeah.
largest meetings in our shared profession digitally, coming from Toronto. Still uncanny times in terms of what we consider normal and abnormal, aren't they?
Definitely.
Young man, let me bring you in. Same question.
Yeah, great to be here. I'm calling in from Ithaca, New York. I'm staying in Ithaca this academic year because I'm currently on a fellowship. There was a rise of cases in last August to early September when the semester just started. And Cornell is currently doing in-person classes, so there were a lot of students in campus, definitely. But I think around 96% of on-campus population is vaccinated, and the university is doing pretty rigorous weekly testing and mask mandates. So the weekly cases are down to less than 10 per day these days. So I think we're okay. Yeah, really good.
96%. Is that
Hmm.
what you said?
Yeah, it's impressive.
Cornell is a massive campus and a large student population, so that's really quite an achievement, I would say.
Definitely.
Youngrim, let me stay with you and ask if you wouldn't mind sharing a memory of this pandemic period, something that has really stuck in your memory.
Okay, so the strongest memory of the pandemic to me will be when one of my family members was actually tested COVID positive for COVID during last March 2020. I was in South Korea back then to do my field work, and this was a period when COVID started to get very serious. It was also the time when there was a huge number of cases happening in New York City. So one of my family members, she was living in New York City and trying to fly back to Korea because the situation in New York was getting worrisome. She was tested positive at the Incheon airport as soon as she arrived. Interesting thing is that she was asymptomatic at that time, but so she could bypass the COVID testing. But she was experiencing the loss of smell and taste, which, by the way, was not one of the known symptoms, one of the known COVID symptoms at that time. So I remember being on phone with her constantly when she was at the airport, and I was like telling her to report this symptom to the quarantine officials anyway. We were both unsure what to do, and that's how she was tested positive. And she was sent directly to the government facility where they were isolating a lot of asymptomatic patients. And she was locked there for nearly 5 weeks until she was tested negative for 3 consecutive times. So it was definitely a hard time for my family, for her, definitely, and for myself. I remember like driving a couple of hours every week to deliver care packages to her. The facility was strictly guarded by Korean military office soldiers, so I could only hand over the care packages to them. But we did that anyway to make sure to let her know that we are here for her and that she's not alone. And we're very fortunate. We are feeling fortunate to have her fully recovered now.
Well, thank you for sharing that. I'm glad she's okay. What a harrowing experience. And
Yeah.
to have her volunteer that information, I mean, had she not, do you think that based on how things were set up at that time, could she have walked out of the airport and gone home?
Yeah. So the testing checklist, there was a checklist for symptoms, and the symptoms that she had was what not in those checklists. So if she just turned in that checklist, then she would be labeled as not having symptoms for COVID and therefore not not subjected to the testing. So if she hasn't voluntarily told that she is experiencing this symptom, then I guess that she wouldn't have been tested positive in the airport.
That's really interesting. I mean, that's, I guess, when the health social contract works, I guess, to a certain degree. Think about it that way. But I'm sorry she had to go through all of that. Yushin, let me come to you. Same question, maybe, if you wouldn't mind sharing a memory that defines this time for you.
Yes, definitely. I think one of the strongest memories of the pandemic is definitely the day when Michigan issued the lockdown last March. It's literally right after our school spring break. I remember it vividly. It was a Tuesday. And then on that day, I had my last in-person class ever in grad school, probably also in my life as a student. So it was a funny thing is that it was a science and technology core theory class. Therefore, when we were doing the class, basically we weren't doing any class readings at the time, but we were just trying to make sense and talk about the pandemic. Well, back then it was still COVID-19, not really a declared pandemic. We're still trying to make sense of the COVID-19 with a lot of theory-dense discussions and trying to make sense of the time. I remember there was a sense of optimism in the air, which is like, okay, we're just gonna do this for a month or something, and then we never knew then when it will end or what kind of impact it will bring to us individually. So whenever I go back to that moment, I just feel like very sentimental and just like unpredictable about the future and anything. Yeah.
Thank you. And I've asked many guests this question, and a few people have responded in a similar way. How long did you think you would be in that situation at that time, if you can remember back that far? How long did you think you'd be out of class?
I thought it would just be a semester thing, and then actually Michigan did bring back shortly in-person school in fall of 2020, and then with the COVID situation involved, it got stopped. But at that time, I remember that night specifically, my family members were checking flights back to China, and it surged up to $3,000 to $7,000 per flight. And then they literally was asking if I want to go back. I was like, no, why would I go back? What if my school resumed in 1 month? And then I never actually was able to go back since then. So that was
19
ironic.
months later. Yeah, it really is. Well, thank you also for that time capsule of your memory. I just want to remind folks you're listening to COVID Calls, and I'm talking today with Yushin Chen and Youngrim Kim. We're going to turn to our conversation now about health surveillance technology. And my two guests have co-authored with a third author, Fan Lang, a quite remarkable article that I hope everybody will check out. Engineering Care in Pandemic Techno-Governance, the Politics of Care in China and South Korea's COVID-19 Tracking Apps. And these health tracking apps got a lot of news coverage early on in the pandemic. This appeared this year in the journal New Media and Society. So please do check that out. And I want to actually just start with a general question. Youngrim, I'm going to throw the first question to you, which is to try to understand a little bit of the prehistory here before COVID. So what was the use of health surveillance like in Korea? I mean, I guess if you think about health surveillance from a public health sense, it could go very far back, but particularly sort of technologically driven health surveillance. Where does that story start in South Korea?
Yeah, so one thing we really try to stress throughout the paper is that it's important to situate these COVID-19 surveillance technologies within the sociocultural context of where they emerge from, because these technologies are not being created out of the blue. So South Korea received a lot of attention during COVID-19 because of its proactive use of digital technologies in COVID response. This includes digital contact tracing and quarantine enforcing mobile apps, among various other technologies. But this disease surveillance technologies have been actively being invested and built since 2015, when this was the period when South Korea experienced the second largest outbreak of MERS, the Middle East Respiratory Syndrome, in the world. So the use of mobile phone location tracking for public health purposes, this was an already established practice in 2015. And based on this legal parameter, the South Korean government and mobile network companies, including KT, have built what's called the smart quarantine system. So this is a system that integrates international travel records, your mobile location data, your card transaction data into the state's public health infrastructure. So for instance, let's say if you flew from one of the risk countries as listed by the Korean Centers for Disease Control and Prevention, let's say, for example, Saudi Arabia, which was marked as the epicenter of MERS coronavirus at that time and until today. So such travel record is noted in the Korea's prescription drug monitoring system, which is also called DUR in Korea. So that your travel record can be immediately accessed by any doctor that treats you for whatever reason. So they would immediately know that, oh, you came from Saudi Arabia. If you are showing symptoms of MERS, let me know so that I could check that. So this COVID surveillance technologies that we are seeing right now is built upon and dependent upon these already institutionalized measures. So, and we're stressing that these already established technologies and measures, they are not just doing the technical work, but also the perceptual groundwork that are necessary when deploying the COVID-19 tracking apps in Korea.
And just to ask you a little bit of a follow-up there about the apps. So are they any more complicated than a regular app? Is there a step in there in which a person has to agree to divulge personal information, or do you download it like you would download any other app on your phone?
You download it like any other app on your phone, but like any other phones, there is like a first page of consent form that you're providing this information, private information, to the state officials. And if you agree, if you have no choice, you have to press agree. And then all the location tracking and the health symptoms that you're reporting to this app is immediately accessible to your designated state official who is designated to you to monitor you for the 2-week quarantine period, which I can elaborate later.
Okay, so we'll talk about that. So that's already established in 2015 with MERS. And was there any pushback, dissent, concern among civil liberties groups in South Korea or anywhere else in the world at that time that this was overreach? Or I guess the other side of that, what was the public health response to? I mean, how did people receive it?
Just to be clear, this app is something new that has been built in like last March, during the initial phase of the coronavirus pandemic. Specifically, this app was built for a COVID-19 response, but the legal parameters, the technical parameters that are needed to like legitimize this app has a precedent. It has been continuing since the 2015 MERS epidemic.
All right, thanks for that clarification. Was there an attempt to build an app in 2015 or a discussion to actually go that far, or they didn't need to do it?
No, largely they didn't need to do it because the outbreak only lasts for 3-4 months. So it was not as long as the COVID-19, and also a lot of clusters of infection happened within the hospitals, not in local, and less in local communities. So there wasn't that momentum to build an app for general users in 2015.
I see, but the legal framework is there. Yuchen, let me come to you. Same question, but from the Chinese perspective. The background before we get to COVID-19 for this kind of health surveillance tracking?
Yeah, so I think for the China side of the story, it's similarly about building on previous data, digital or institutional infrastructures, where I would like to emphasize that public-private partnerships of developing such platforms and data sharing practices have been happening. For example, as we mentioned in the paper, the social credit system has actually been brought up quite a few times as an example of how China has been using such kind of surveillance measures to regulate society or maintain certain kind of social order. But then I will refrain from saying it's simply a technical system for surveillance purposes, but it definitely shows one of the processes of like Chinese government's efforts in digitization and platformization of e-governance or any social management related works. I also want to emphasize that even in pre-digital era in China, there have been various kinds of such analog infrastructure existing, such as the Hukou system and Da'an system, which is a personal dossier system recording personal information and histories. So those things, those analog systems also performed a regulation role. But for public health specifically, there was after SARS in early 2000s, there have been the central government have been developing a system of direct reporting system that allows local CDCs and local hospitals even to report to the central government specifically if anything happens. While some argue that this system has failed miserably in the COVID-19 case, but I did not go too deep into researching the system particularly, so I would just use it, say as an example that it did like echoing Yang, which is they should be considered as a continuum of both countries' efforts in bringing things together with digital technologies or with technologies at large.
Right. So this is why you always need to have historians of technology in the room, because we're here to tell you about the continuities. And I I think this is what you both pointed to, of course, an area that I hope you're researching and others are researching to try to put these health surveillance apps in a much longer sort of continuum. But there are differences, and I think we should talk about that. So maybe just Yushin, let me stay with you on this. Talk a little bit about the moment that the COVID-19 health tracking app, if there's one, maybe there's multiple of them, I don't know, in China. Tell us about that early phase, the development and the deployment of it. And I would just add, I remember exactly where I was when I saw the first sort of news coverage of that. And it was also in the context of the Wuhan lockdown. And I had sort of two immediate reactions. One was really kind of startled by it. And then when I saw that in the context of the lockdown, there was a sort of logic that clicked in. And I thought, oh, this is a comprehensive thing that was not dreamed up overnight. So I didn't think about it as clearly as you're describing it, but I already sensed there was a continuity in play. But I'd like you to say a little bit more about it, if you could.
Definitely. I would probably say a little bit about what the system is, just to give a context of how the system works as its mechanisms. So it's actually called the health QR code system. It's basically function like a QR code that classifies people into color codes. There are red codes, there are yellow codes, there are green codes, and those codes manifest whether people should be quarantined or not and how long they should be in quarantine. For example, like red code means you need to quarantine for 14 days, while yellow code means for 7 days, and then green code means you're free to go anywhere. And the health QR code is basically built it firstly appeared last February 9th in Shenzhen, which is the headquarters of Tencent, which is the company who owns WeChat. And then shortly after, it appears in Hangzhou, a system developed by Hangzhou's government and collaborated with Alibaba. So both codes were built on already existing infrastructure, but it's owned by private sectors, especially those tech giants in China. And then the code itself requires to collect data, specifically 4 kinds of data from the users, at least in the initially phases, for using those data to access and sign color codes. So they require personal information such as gender, name, ID numbers, and then they require users to upload and log in their daily health data, such as symptoms or temperature, and if you've been in any like risky areas. beyond those things, they also will verify in the back end about with geolocation data to see if they really have been traveled to those areas and if their self-report has been true, right? Other things might be included in this app, which might be like testing results if you went for a test, things like that. So it's pretty comprehensive app, I would say, because it requires interactions between the app and users, but then it also will have a very systematic database behind for verification processes. So like I said, back to how it's developed and deployed in different countries. So initially it was a public-private sector collaboration. So tech giants and municipal governments collaborating to have these kinds of apps available at that time. But then later on, it really got deployed around the country very quick. And then the government rhetoric being like, this manifests a kind of Chinese speed, because it only took 7 days for Alibaba to put the codes around over 100 cities, and then it only took them for 40 days to have it nationwide. So it was praised as a kind of speedy reaction to contain the COVID-19 in China. And then there was also, I vividly recall reading this article saying how Alibaba's programmers actually, so during the development phase, it was actually during Chinese Spring Festival, which is deemed as one of the most important festivals and holidays in China for family reunions, right? But then I saw this report saying like how Alibaba's programmers actually sacrificed themselves in their private times with families to develop the code and make this happen, so that, you know, like the whole nation can sort of enjoy a more safer environment. And yeah, so I would just stop there. And
I'm glad you put that note there, because we'll return to it. This sort of idea of national sacrifice involved with this broader project is an important one, as you point out in your article. Youngrim, let me come to you. Maybe you can develop a similar kind of narrative as Yushin did, but for South Korea.
Yeah, so similarly, South Korean app, but the South Korean app is similar and also different from the China's app that we were talking about in the paper. The South Korean app that I'm specifically talking about today is the self-quarantine safety protection app. It's called 자가격리 안전보호 app in South Korea. It's a quarantine enforcing app, which means that it was developed to monitor people under home isolation and track their location to make sure that they're not leaving their home. The discussion about this app was brought up starting from mid-February 2020, when there was a growing public concern over people in home isolation violating the quarantine rule and going outside. And by the way, when I'm saying people in home isolation, this is not talking about people who are tested positive for COVID-19. They go straight to government facilities. I'm actually talking about people who are in close contacts with confirmed patients or also recent travelers from abroad who are considered as high-risk group for contracting COVID-19 in South Korea. And these two groups were strictly subjected to mandatory 14-day home isolation. In last spring, in 2020, the media coverage heavily reported reported self-isolation violators as huge threats to the local communities. And because public concern grew about this issue, the Korean government developed these apps to track people's mobile phone location to make sure that these people who should be self-isolated are indeed at home. So if you install the app, there is a designated civil servant that is matched with you, and that person will monitor your location and monitor your health symptoms during the 2-week quarantine period. And if you violate this rule, you can be subjected to criminal charges, including fine and imprisonment. So this app was released in early March 2020, and it's still being used by the state.
So I just want to make sure that I'm not... that I'm keeping the two different apps and approaches slightly separate. So the one in South Korea, then, as you're describing it, Youngrim, is a quarantine app. So it's meant to come into play when someone, I suppose, has been exposed, they know they have been, or when they're traveling. But it's not something that all South Koreans who have mobile phones were required to carry. Is that correct?
Exactly. Mhm.
Okay. And Yuchen, in the China case, the app that you're talking about, or the QR, um, was that required of everyone in China? This is a sort of compulsory thing for all citizens, or similarly, only people who had had some kind of exposure or in a dangerous zone?
Yes, I think that's a great distinction to emphasize here, because in China the app is mandatory to use. It's actually enforced to implement by grassroots government workers. So that's a very important distinction. And one more thing I would add, which is when I introduced the deployment development of the system, actually starts from cities. So initially, or at least in the first few months, when we conducted the research, I need to emphasize that there are different apps and um, different interfaces for different regions and cities, because of during that time the risk level of different regions and provinces are so different. So there was technical difficulty in actually develop a nationwide unified system. So that's also like important side note.
So there's a moment in time there in which different regional governments are operating at different pace, Yuchen? So we can
Yeah.
capture that? Okay, that's interesting.
Yeah, and also initially when people need to travel, for example, from one province to the other, he or she need to download two apps for those two cities and
Ah.
logging their self health status every day in both apps. Otherwise, they cannot actually show the code and travel across regions.
And Youngrim, what about the South Korean app? This is developed. Tell us a little bit more about who develops it, who has oversight of it, and how that worked.
Yeah, so the South Korean app is very centralized. It's developed by the Ministry of Interior and Safety. This is the ministry that's responsible for this app, although the Ministry of Health and Welfare and Korea Disease Control and Prevention Agency have also collaborated in building this app. So yeah, it's more centralized than the Chinese one.
So I have kind of like a historian's question here for both of you, and it has to do with um, as you think about this kind of research, how much access did you have already, or how much do you think you'll have in the future to the kinds of records of deliberation that went on behind the scenes? I mean, you're describing, even Young Remo, what you're describing in multiple government ministries here that have some sort of input in this. These are not small agencies, I should say.
Mhm.
A lot of bureaucrats, a lot of scientists, a lot of communication, I'm sure. Um, I guess my first instinct would be to say some of that'll be public and some of it will never see the light of day, but I don't actually know how those percentages break down. Do you have any sense of how much that you can get access to?
You mean like to actually like speak with some of the state officials who were building these apps?
Yeah,
Back to back.
absolutely. Hmm.
Right. So when we were writing this research, we were doing discourse analysis. So we were mainly depending on like the first and primary materials that has been written about these apps. But after that, for my dissertation research, and even before that, yeah, I did gain some access to interview some public health experts and state officials who were involved in building not only this app, but also other surveillance technologies that has been deployed in South Korea's COVID surveillance. But I must say, it was very difficult, and they were very conscious about having what's going to be out about what's going to be like out public about the government's work within it. And especially when I was asking about the MERS epidemic, it was more difficult to communicate that, because MERS epidemic was a national crisis in South Korea, and there were a lot of government officials who stepped down from their position because of the missteps in managing the MERS crisis. So, but for COVID, especially earlier last year when South Korea was trying to like heavily promote their COVID governance as a key quarantine and as a model for international other countries to follow. That period, it felt a little bit easy to bring people to interview, to bring people to talk with me. So yeah, I think it depends on like what the public discourse around state governance is at that moment.
Yuchen, same question. I think, everybody wants to know, how do you get access to these kinds of materials, if you can, that take us inside the sort of development of the app and the internal debates within the government as to how to roll it out?
Yeah. I would say I would just use our paper as an example to say my general reasoning. When we did the research, we really heavily relied on public discourses surrounding the apps themselves, because during that time, firstly, it's a very new phenomenon. It's actually, we're trying to capture the historical moment where things got just emerged. So a lot of conversations, we really just capture it on an everyday basis, and then to try to get as much. But I would say we were trying to get as many perspectives as we can in our paper, because when we do this public discourse analysis and when we incorporate, for example, media discourses, and then we also would like to pay attention to, for example, how users think of it, and then how different actors kind of speak to the same thing, but then using different languages, or see if they are speaking for or against each other. So that's an important way for us to piece out like how such things got constructed, but then not from a just single perspective. Other than that, speaking of access in general, I think it does get increasingly hard, especially when I'm physically not
Sure.
in China. So that's been a constant challenge, especially after the pandemic. And yeah.
Just want to remind everybody you're listening to COVID Calls. I'm talking to Yuchen Chen and Youngrim Kim today about technology of surveillance in South Korea and China with COVID-19. And I want to turn back to your article here, and I'm going to actually I just want to read. We're going to talk about how the public perceived these apps and how the government and the public sort of develop a relationship, if you will, mediated through this technology. I'm just going to, beautifully written. I just want to quote here. In both China and South Korea, we discovered that materials from state and news media constantly defined and discriminated between ideal and deviant subjects of the apps. We argue that such defining work served as a vital mechanism that justified the needs of the apps by targeting deviant individuals as objects of blame. And you talk about that as sort of conceptual analysis there, as establishing what you call structures of vilification. And you also give us some analytical tools to think with from a politics of care discourse as well. So, these apps and their rollout have to also be part of larger public health apparatus in South Korea and China, in which the state defines itself either as scientific leader. I don't think we have to choose among these, but some of the options: scientific leader, a punisher, a tracker, a mother, a friend. And of course, people who study, state use of technology are always interested in the ways that how a new technology, either for warfare or for health, gets characterized by the government agencies who have that responsibility. And I think this article makes an interesting contribution to that ongoing discussion. Youngrim, let me bring you in on this first to talk about the ways that uptake worked, how citizens reacted to the app, how news media and how the state sort of packaged their discourse around it. Take us into that world, the vilification or the mothering of the app, if you will.
Yeah, to speak first about vilification, I do want to speak a few notes about the politics of care, which is what our paper is heavily centering. So the politics of care is a concept widely discussed in feminist science and technology studies, which tries to understand technoscience as deeply biopolitical projects and central sites of ideological production. So the politics of care understands care as always embroiled in this messy, non-innocent politics. And there has been a stream of literature that tries to understand how the concept of care is strategically deployed as a means of technoscientific governance. So we try to bridge this perspective, this framework with surveillance to understand how care is manipulated in state projects by being framed both as an affordance and as a phenomenon of surveillance. And we try to grapple with this blurred boundary between care and control in surveillance activities. So now going into vilification, when we're looking at these discursive materials, user reviews that has been written about these apps, we were trying to understand how they were constructing the cultural understanding of these apps. So for the Korean app, so for the Chinese app, we identified a lot of themes around repair written about the China's app, like repairing the early missteps of China's information secrecy about coronavirus. For the Korean materials, focus a lot about protecting and safeguarding the nation from both external and internal threats that can pose threats to the communities. So in this case, the language and feelings of state care was mobilized by constructing this outright enemy, the image of an outright enemy, be them foreigners who carry the virus to the Korean soil or people within the country who do not follow the prevention rules and behave wrongly. So I say in the article that this idea of state care that these apps try to claim, that these apps claim to provide, is built upon these structures of vilification that actively define and manage the deviant and risky bodies as targets of surveillance. But also, I do want to mention here that the Korean app's role was not just to track the subject's location, but it was also in place to monitor the user's health, who are definitely in high risk of contracting COVID. So people under home isolation had an immediate point of contact, this designated civil servant, whom they can ask questions or ask assistance when they are feeling sick. So in the early phase of the pandemic, when there was a lot of uncertainty around the virus, having this immediate point of contact generally gave a lot of reassurance and relief. That was definitely the dominant emotion that we identified in the user reviews. And it was interesting that the majority of user reviews during this period were expressing appreciation to their designated civil servant when they were describing their feelings about this experience. But I assume I haven't followed along that deeply after we published this research, how that discourse is going on right now. But I assume that it would have changed radically as we know more about the virus itself, and as people's fear toward the virus kind of becomes a little bit numb as the pandemic goes on. So that perception would have probably be changed by now.
Let me just personalize it for a second and ask about my own experience, and maybe you can translate it for me a little bit. And Yuchin, I hope you'll tolerate this just for a second, because I arrived with my family here in South Korea in February of this year, and we had a 2-week mandatory quarantine. And of course, for people know, I mean, to come from the United States, where it was like show up at the airport, they're like, how you feeling? Check a box. I mean, if that, I mean, it was very lax. To arrive in South Korea and have multiple checkpoints that you have to move through before you go through secure customs, and they take your phone and they install it for you, so that somebody like myself can't make a mistake, which I probably would. So, but our experience of it was the daily check-in, in which you had to take your temperature and input that information. But there was not what you're describing as sort of more personalized relationship, or where it was made clear that a civil servant was actually sort of in a one-to-one relationship with you, mediated through the technology. Maybe that had changed by that point, but that wasn't emphasized to us. And so I felt very kind of ambivalent about it. On the one hand, I felt, frankly, so much, it was so different from the United States experience. I felt some relief that somebody actually cared to know whether I was sick that day or not, which again, I think you can just use me as one more data point there. But also that discomfort in the entire time that, hey, if I walk out of here right now, somebody's going to come find me. And I'm constantly sort of juggling those two emotions. Of course, I had a lot of free time to juggle them because I was locked inside for 2 weeks. So I wonder, had it changed, had the app's deployment and this sort of affective governance around it, had it changed by that point?
Yeah, at first, one thing that I want to mention that was how this app was actually like rolled out and practiced in local districts, like varied widely. So there was a local district that was like 24/7 looking at the app and seeing whether you are like accurately reporting health symptoms. That was in my case, that was the case because I also traveled. I also installed this app and had 2-week mandatory quarantine this April. So that was the case of me. So the experience varied widely, but also it's right that early in the pandemic, like last year, they were heavily investing a lot of civil servant efforts in monitoring these apps more than this year, where like by now, like I don't know, like they have I don't know what's going on, but they have different priorities within the local clinics. I know that they are also managing a lot of like contact tracing work. So maybe and when there is less case last year, it may be like number wise there were less case last year than this year. They may had more effort, more effort, more I don't know capacity to actually monitor the close contacts less than now, more than now. So that may be the reason what's going on. But the experience varied widely. That's what I can say.
Okay, Yuchen, let me bring you in just to comment on anything we've been talking about here that you want to add about this sort of vilification idea or the politics of care. And thanks for putting up with my own personal story getting intervened in here. But I've got expert translators for this experience I've gone through, so I couldn't resist.
Not at all. I think that experience itself really speaks to what we wanted to say, which is to understand why seemingly surveilling and like seemingly or like according to some Western media discourses, why seemingly like oppressive controlling system will be appreciated on the ground, right? So it's really through this experiences and efforts of care that you kind of justifies and slowly normalizes such systems. And then I just cannot help but pointing to one thing Yoren mentioned, which is about the labor, the actual like materiality of such apps, the invisible or sometimes visible human infrastructures that perform and enacting such care to the citizens that really functions alongside the technologies to make this structure of care more solid. And then in China's case too, we really don't have the one-to-one kind of point person you can contact, but throughout the research, I realized that the personnel, including volunteers, in Chinese we also call them like frontline workers or gig workers. They really help managing and they really help manage and then sustain a kind of normalcy for everyday life for the citizens. For example, a lot of citizens when they were quarantining at home, it is through these frontline workers who constantly deliver food and medicine to them to help them sort of have a normal everyday life sustainability. So I think that's important to emphasize where human labor comes in and how the care itself is enacted through them as well, and they kind of embody a certain kind of relationship to the state.
So just to go a little bit further with this, and Yuchen, let me throw this to you first. I mean, can we conclude then that in the China case that the health tracking technology, did it increase affection for the state? I mean, how do we come to know the success or failure of the government's efforts to divide people up, sort of good subjects and bad subjects based on how well they comply with the use of the technology? Did it work in that regard, and how do you measure it?
That's a great question. I would say in terms of measuring it, I think the wording of measure is an interesting one, and then I will elaborate on it a little bit. In my case, right, I think the judgment of success or failure of such apps is really depending on where do you ask the question, who do you ask the question, and then when do you ask the question. Because I would say initially when the apps come out and compared to now where it is, we should situate this in a larger geopolitical situation, which in China's case, constantly it's being compared to what's happening here in the United States specifically. And then Chinese, during my interviews with certain users in China, they constantly compare how there's how, because of Chinese people have this collectivism, and because the government themselves can mobilize the people to cooperate, so that COVID-19 got contained in China instead of something like America. So that thing is just constantly being that comparison just constantly being conjured in my interview and informal conversations, especially even to my like family members. That I found really interesting how the app itself and the success of it is through this constant positioning against the United States, and it has a really temporal sense in it as well, because it because like it kind of proves itself along the time, and that kind of is one very anecdotal or one specific example of how I would say how to measure this kind of success. But back to like me as a researcher, I would say for qualitative analysis, we kind of try to see a pattern emerging out of discourses, and then see how it kind of speaks to a certain kind of ideology or common sense. And the more I go through the data, and the more I see this wording of care, serving, reassuring, hope coming up as a very positive energy in both state media and in people's everyday life, talking about these kind of things. That in that way, I kind of come to, not conclusion, but come to my observation that that's how I measure how the apps work on people's affective relationship to the state. Yeah.
That's thank you for that. And Youngrim, I want to ask you the same question, and I'm particularly impressed by this problem of calling anything a success or failure in COVID, because COVID has changed what it is as a pandemic, even in any, so let's take the United States, at least been 4 different acts as far as I'm concerned. Maybe we're entering a 5th one of what it means. And then, of course, the minute you start looking in different parts of the country, success or failure will mean very different things. So I think Eugen's caution there is very well taken. Having said that, I'd still like to hear from you about this question of maybe, can you generalize a bit about how people reacted to this invitation from the state to receive care, and also this challenge from the state, you must receive care?
Yeah, my response would be very similar with Yuchen's, but first of all, it is like, at least during the initial phase of the pandemic, like last spring, which is the period that we researched for public discourse, it's true that the state's media and user reviews all spoke about like national pride was a very big feeling that were crossing all that came out across all these materials, and in that sense, maybe the states and the experts did a good job in like conjuring this feeling of national pride, that Korea is doing well. Korea is especially doing well compared to other Western countries, especially compared to the U.S. And it's because of that national pride over how much Korea is a technologically advanced country, what definitely came across all of these materials. And if we say that that's how like affection was built, maybe yes. But as Yuchen said, it depends on when we are asking this and who we are asking this, especially in terms of success. Success is a really interesting term to me as well, because I had a chance to interview a lot of activist groups and engage with activist groups who were fighting for human rights during in response to Korea's COVID-19 surveillance. And their definition of success was very different. So yes, Korea may have lower numbers of positive cases. Korea is doing relatively well in controlling the local transmission, but at whose expense? At whose rights are being violated? Whose marginalized conditions are not being cared for in order to prevent the numbers from going up for the general mass. So that question was always being brought up, and I wholeheartedly believe that people who are marginalized and people who are not in the condition to keep appropriate social distancing, who can work from home, who can do 2 weeks of self quarantine without getting any wage, like. And I don't think Korea did a good job in taking care of those people who are vulnerable, who are disproportionately vulnerable to a public health risk like this. And if you're measuring success by that, then I would say there's a lot for Korea to do. There's a lot that we still need to do.
Just to draw you out a little bit more on that, I mean, from what I know of the cases in South Korea, particularly early on, there were a large number of them in congregate care facilities, and facilities with people who had disabilities, people who were forced to live together in high density. And then also there's the issue of the digital divide, which we haven't talked about yet. That for those, I mean, by doing this as an app, the state itself has already kind of pre-decided who's in the care group, and then who will receive some other kind of care if we can get to it. But they're not going to marshal the strongest tools to that. I guess what you're describing very much falls into that. I just want to give you another chance to say a little bit more about your observations in that regard, and then I guess to follow up, does that become a basis of activism, or is this just a moment that is too fleeting, too wrapped up in the sort of broader discourses around COVID to build on? Because I think it's an important observation, but I wonder what you can do with it from an activist perspective.
So yes, there were a series of events, very discriminatory actions that have been being done, especially on LGBTQ communities and migrant workers communities regarding COVID technology surveillance in South Korea, and activists and human rights activists have been organized around those incidents to respond to these incidents and stop these discriminatory actions being executed. So I don't know. One example that I can give would be this March, when there was a series of clusters happening in workplaces where the majority of employees were migrant workers from South and Southeast Asia. So many local governments made this administrative order that mandated this testing to all foreign workers. And if they do not follow this testing, they would slap fines. And this order drew a lot of backlash, as it was racist and xenophobic and also unscientific, because the same order was not given to Korean nationals who are working in the same sites. So while some of the local governments withdrew this order after this public backlash, many retained, and it's still going on. And activists, these groups were coalescing these times to kind of respond and react to these discriminatory actions. And they were, in a large of their efforts were telling the public, telling the government that just simply enforcing this discriminatory testing order is not enough, and it's not good when the local governments are not really paying attention to the poor workplace environments that these migrant workers are living in, which is impossible to maintain social distancing, and not even providing like essential protective gear such as masks and sanitizers to foreign workers. While Korean employees who are working in the same space are provided with these tools. So also the testing order was not feasible to many of these workers because the majority of them live in the workers' dormitory, and their boss would not let them go outside the local clinic during the weekdays and during work hours. So the workers could only get tested on Sunday, which makes the clinic very crowded, and some could not get tested because there was a shortage. So this is one example of series of discrimination and violence that have been happening in Korea in the name of public health. What I want to stress here is that COVID and the technologies that South Korea has built to control COVID very starkly has shown how the state and the Korean society perceive who belongs to this country and who are worth to protect. So the technologies like this app that we have been discussing so far, it may be useful to able-bodied middle-class user who holds the Korean citizenship and looks like one and tech savvy and all that. but it is but it is exclusionary by design for marginalized users who don't have a safe space to be in, I don't know, 2-week home isolation, who fear of getting laid off or being evicted from workers' side dormitories if they don't show up for work, et cetera, et cetera. So the problem is when these technologies label those who violate the instruction as deviant subjects that pose a great threat to the community, without considering these unequal socioeconomic conditions, then the vulnerable communities again become the easy targets of more oppressive surveillance. And this is a vicious cycle.
Powerful observations there. Thank you for that. I want to just circle back on one thing about the foreign perception of what was happening in China and South Korea. And Yuchin, let me get you to comment on this first. The Western media, Europe, and the United States, of course, and we had a president of the United States who was actively using mostly China, what was happening in China, as a foil for his own actions, and characterizing the virus itself as an invader and invoking uh, a full 150-year history of anti-China politics and racism in the United States. And he played every note perfectly, the racist that he is. Of course, he was able to do that. And so I guess I want to ask you about like how you thought about that news coverage, because I'm sure you were tracking it, but more specifically, the ways that the apps were being handled by the Western media, because I saw quite a wide variety of coverage. I mean, there was a sort of enthusiastic strain. It's sort of like the Wired magazine kind of strain, like, wow, this is, and of course itself has its own kind of embedded essentialism. It's like, hey, here's East Asian tech again, doing something exciting, and Asia becomes this one place. I mean, very confusing and kind of unfortunately predictable. And then the other side of it, it became a rallying cry for right-wing populist white nationalists who said, see what's happening over here in Asia, and that will come to America too, unless we, and of course they never really define what they want to do. So I don't mean to rant, but I was very exercised by that just from the American side. I'm surely curious how you perceived that news coverage and that spectrum of American or European response.
Yeah, sure. I think this really like nicely plays out our conception of structural vilification, but in a more like geopolitical context, especially like how the United States and Trump trying to shift tensions to China and kind of stigmatize China by doing the work of blaming. And then I really appreciate you mentioning the longer history of racism and racialization of China and Chinese bodies in the United States history, because it has a I encountered this really amazing archive in the Museum of Chinese in America in the past week. And then, so they documented that in the 19th century, one of the central tenets of justifying the exclusion of Chinese in America was through the condemning their bred disease because of their claimed diet of like exotic animals and horrible living situations. Similarly, this was taken up in 2003 when SARS happens, and now again, like we see repeated in COVID-19 as well. So it really surges to this material consequences of violence rooted in continuous racialization of an entire ethnicity, of equalizing them, like equating them to origins and carriers of disease, which is really dehumanizing and racialized. So that being said, it kind of now tracing back to the technology part of the question, intersects with the rhetoric of a fear of quote unquote the rising China and the rhetoric of a whole new tech war or whole new tech cold war between the United States and China, of seeing Chinese and Chinese technologies really as a threat with embedded surveilling potentials to United States. So that being said, a continuous racialization of China and Chinese bodies intersecting with contemporary geopolitics of such a Cold War rhetoric, I kind of see this phenomenon you mentioned embedded in those two things majorly going on in contemporary days. And then I personally would just take it up as our paper kind of can act as a response to that by really ground in the on the ground lived experiences to argue against certain kind of dominant construction, especially by the United States, of certain kind of Asian or Chinese technologies at large.
Youngrim, just to give you an opportunity, how you thought Western media covered what was happening in South Korea with these apps. What did you see?
I mean, I largely echo what Yuchen just said, but I mean, it was largely essentialist and reductive, and like trying to explain what's going on in China and South Korea with like Asia's collectivist culture and their compliance with authority. But I think those were the major like narratives that has been circulating in the Western media. But I think South Korea is in a weird middle place because like at least for my observation, I thought like some articles, as you said, Professor Knowles, like some articles were like, oh, South Korea is doing great. We need to follow this. They're the model. But also at the same time, there were a lot of like mixed articles that was saying, oh, maybe they're collecting too much information. They're priving a lot of they're intruding a lot of private information, and maybe this is no. The Western societies don't want to do this. So that was the mixed responses that I was also observing, and I felt both of them very reductive in a sense, and as you echoing you, Chen. I wanted to see how these apps were culturally being understood and their cultural meaning were being assigned to these apps throughout the period of pandemic in the local grounds. So yeah, that's the area that we wanted to contribute with our paper.
Okay, we're almost up on time. In fact, I've gone over time as I thought I might because I've been very greedy with my colleagues' ideas here today. But it's a great discussion. I just want to have sort of one more question, and Youngrim, I'll ask you this first. I'm sort of curious what happens next, and I'm not going to use the term post-pandemic because I'm not sure I believe in it. But let's just say as we move into the next phase here, I was really interested in your description early on and looking closely at the data at the mixed feelings people in South Korea had about the use of the app. And in some ways, I guess it also, talking about continuity, it's to a certain extent, it's a referendum on how people feel about the National Health Service and their doctors more generally. I mean, it's hard to disentangle when people think about health. It's hard to disentangle. They don't say, well, I feel this way about this agency and I feel this way about this app. And it's a bundle of emotions that are wrapped up there. So I guess my question to you is, what are you looking for next? What are the kind of questions you'll be asking next about this relationship that's been forged through these apps? I mean, to me, one of the possibilities is that it actually increases people's demands for healthcare. And maybe I'm being naive here and I'm a newcomer to South Korea, but I could see it working that way, that when you provide something that shows competency and people get used to it, they say, I'd like more of that competency, please. I don't know. What do you think?
Yeah, I really appreciate this question about continuity and how that's going to extend beyond COVID. And yeah, one of the things that I'm most concerned about is these technologies are already being normalized and very much routinized into the healthcare systems in Korea, and it's happening in a way that is not explicitly like, so the patient, when they go to the hospital or when they go to the local clinic, they wouldn't explicitly know like if such controlling I mean, what kind of informations are being collected and integrated within the healthcare system, public healthcare system. So that's like the routinization of this emergency practice, of this collection of massive amounts of personal data, and how that's used for governance, how that's used for public health, is a worrying area for me. And I'm saying this because I know that the contact tracing system, the digital contact tracing system, the Korean government has developed and is developing throughout the COVID-19 pandemic, it's getting bigger and bigger, and they are collecting more and more data that is like they're collecting CCTV footage, They're collecting international travel records and card transaction data, and more data are being integrated to that system. And it's using to predict where is going to be the next hot zone. Where should epidemiological surveys should put their efforts on to accurately predict where a large clusters of cases is going to happen. And that kind of like bringing algorithmic system into disease prediction is a worrying area for me. And that's where my dissertation and my next research would also delve into.
So Yu-Chen, let me give you the last word on this. What do you expect? What kind of continuity is flowing out of this COVID era might you expect to see in China in terms of surveillance technology?
Sure. My research doesn't really concern with public health related technology, but through this paper, it really helps me to see two things I would like to point out. First is by thinking through those conjuring of China's big brother surveilling state-ish kind of discourses, it kind of presumed that it's a top-down, unidirectional kind of power relations between the state and the citizens. And then through our research, I gradually kind of can grapple with this kind of not just top-down, but bottom-up agency from the citizens. They kind of act as an agency which can kind of claim some power within citizens' hands, but also it has some complicity in it that kind of facilitates a kind of social mobilization for further normalizing certain kinds of technology and social technical systems. And then the second thing is it really helps me to see how certain things got emerged while it's also got routinized and infrastructuralized. Because through this research and later on, the health QR code really is embedded in everyday life. For example, if you go to a bus, you need to show your green code. And if you go to a hospital, you also need to show your green code and things like that. It really showed me how through mundane practices, certain kind of technologies got stabilized and infrastructuralized into everyday life. And those two things I will carry on in my future researches and research and see how in different kinds of scenarios or even in pre-pandemic scenes, how certain kind of things have similarities or dissimilarities in their normalization.
You've been listening to COVID Calls, and you can catch COVID Calls most weekdays live at 6 p.m. Eastern Time. And I want to thank my guests, Youngren Kim and Yu-Chen Chen, authors, also with co-author Fan Lang of amazing new article, Engineering Care in Pandemic Techno-Governance, the Politics of Care in China and South Korea's COVID-19 Tracking Apps. You can check out this article in the journal New Media and Society, open access. And thank you so much for this work and for taking time in the middle of a very busy conference time and all of your other writing to explore it in this detail. Thanks very much.
Thank you.
Having us.
Stay healthy, everyone. We'll see you next time on COVID Calls.